On behalf of the Center for Crisis Studies and Mitigation at the University of Manchester, my name is David Schultz, and I'm a professor of synoptic meteorology and principal investigator of the center. The purpose of our center is to develop a wide network to bring together researchers across the university who work on natural hazards and their impacts on society. Anyone can join on or off campus, so please get in touch if you're interested in being a member and hearing about our activities through our newsletter. You can sign up for our network on our webpage. To stay informed of our activities, you can also follow us on Twitter at Crisis Studies. This is another one of our continuing webinars in our series. It's been going on since May of last year. Many of them are recorded and available online at our YouTube channel. Our next seminar will happen in the autumn, so stay tuned for that information. The format of today's talk will be as follows. During the seminar, you can enter your questions in the chat box. We will do our best to get to them all during the question and answer session at the end. For now, let me introduce our speaker, Neil Bourne, Professor of Matter and Extreme Environments and co-director of the Thomas Ashton Institute at the University of Manchester. He's by training a physical scientist and has extended his expertise into the areas of risk, occupational health, and workplace stress. He works with universities and government and directs national and international institutes in health and safety and the national facilities science using X-rays, neutrons, lasers, and supercomputing. As I mentioned, he's the inaugural director of the Thomas Ashton Institute, which partners the university and the health and safety executive to deliver research, learning, and regulatory insights to enable a better working world. Further, he leads the portal to the UK national laboratories at Harwell and Daresbury, supporting research within the University of Manchester and across the international network. As you can see, the title of his talk is titled How to Build a Resilient World Post-Pandemic. Professor Bourne.
Thank you very much, David, and welcome to everybody. It's a real pleasure to talk to this institute. Many of the issues that you're dealing with are so close to the heart of my personal subject areas of interest, but also obviously to the considerations that the Institute has, looking particularly through the Thomas Ashton Institute with the world of work. So I'm hoping what I'm going to talk about today will give us an overview of some of the different crises that we may come across. And particularly, I'd like to talk about the ways we have to control the risk in those crises and the regulatory craft that goes with that to try and control the risk for particularly the populations that we have within our individual countries, within our individual organizations, or even down to personal risk. Of course, last year has been one of the most extreme on record. The hottest year on record, the wildest hurricane season, record high atmospheric carbon dioxide levels, apocalyptic wildfire seasons, super typhoons, tropical cyclones were at a record, hottest reliably measured temperatures, and indeed it turned out when all of this was put together to be the most expensive insured year for the companies that try and look at these things. On top of that, there were several man-made hazards, and again, they resulted in not global, but certainly country-level activities. One in particular was the explosion in Beirut that you might have read about, a colossal explosion at a warehouse site where explosives were being stored. And that came from a structural collapse that led to a hotspot and then led to the whole of the business district of Beirut being severely damaged with large numbers of people homeless. So how can we mitigate against these? How can we prepare for the unexpected? And how and what resource should we put into these low probability risks, ones that we're not going to see many of coming along? So I'm going to talk about several different classes of hazard. Physical hazards, fire, flood, blast, I've already referred to in what we've said earlier. But obviously the biological hazards are being particularly in people's minds at the moment because of SARS CoV2 and all of the effects that that's had internationally across the way the human race considers its future and the way that it will act under these threats. So these hazards have impacts, and those impacts have different scales and different severities. And particularly the speed at which the hazards attack us is a real discriminant into the risk that we would potentially have to mitigate against as either governments or individuals. So what is it that we mean by a risk? Well, I'm talking here about the chance of harm from a particular hazard. But it's a human concept, so it's not just a damage that we're looking for in a physical sense, but that includes all the ethical, the economic, and the social implications that one has to consider as a society. And clearly, for each of us, risks have different levels of tolerability. And so how do populations define their level of acceptance? And then how is that put into some type of a control by governments that we elect to try and keep our societies together? So we as a nation have a national risk register. On this national scale, we have defined several of these hazards that we wish to prepare against. And obviously, these are particular threats that we can consider, but we also have to consider how long we have to respond to these when we start considering the risk. So that particular report, and you can get it off the web at the address if you're particularly interested, classifies the impact that we're going to get from one of these hazards in a particular series of ways. And it produces an integral of these to try and assess a national risk for something. You can see that chemical and biological attack is at the top of that in terms of a humanly delivered hazard, but we also have pandemics up there in level E, which is the highest of the impacts that they are worried about us having. And underneath that, you can see nuclear accident, coastal and river flooding, and electricity grid failure as a result of either of those as being significant risks that we see to the country. So as a regulator, how does an organization like HSE try to control our risks by responding and mitigating to these hazards? Well, we have to consider whether we're talking about animate or inanimate structures, the scale at which we're trying to apply a hazard to a structure. And we also have to consider what that pressure that we put on that gives in terms of a response. And the response that we get depends on the strength of the structure that we have. And that structure may be a physical structure, or it may be a population structure. And through training and through various practices, one can increase the strength of a workplace structure so that we can withstand any pressures from particular incidents that might come along and try and load the system. And so it's that mediation of pressure against strength that we are trying to ensure we can minimize. And the stress that results from the pressure is determined by the strength that we endue in our population. So for instance, in the human case, good training and a significant planned workforce ensure greater strength or resilience in the way that people handle the pressures that come across them. And so good work-life balance, for instance, makes stress easier to cope with and allows work to be even motivating, as all of us know, of course, working for the University of Manchester. But we as societies invest in regulators that will try and ensure that there is a common level of strength and maximize the benefits that result from that in the workplace, particularly in terms of HSE. So we need to look at different scales at which we're acting here. The hazards clearly act across a whole series of different scales, and those may be at the population level, if you're looking at something like SARS CoV2, or they may be down at the individual level. And the response that you observe at a population and an individual level, of course, may be very, very different to one another. Equally, inside an inanimate structure, a component sees different stresses and strains according to its composition. And ultimately, down through the scales, one's talking about the individual atoms that one might have in the alloys that we make, for instance, a jet engine at. So again, the individual response and individual strength is very different from the global or the population level strength that we're trying to look to. Yet nevertheless, we need to plan and we need to try and determine the risk involved for how we control any of these pressures that we might put our structures under in the future. In terms of physical structures, we can look and see where the problems are likely to lie in our populations. We can see here inside an explosives crystal, individual defects in the structures that we observe. And those defects will cause localizations of stress and strain, which will give rise to potential chemical reaction and problems if we load this explosive material. But how do we do that inside populations? And we need to be able to there look at differences in the way we react to different stresses, how different training has given rise to splits in the way that we'll react to things, how cultural differences might allow us to respond differently to different levels of risk, or indeed how much in the end different genetics control populations to have different response. And so we tend to allow our risk to be controlled, and we enter a contract with government, a Hobbesian bargain, to allow the population to minimize its risk by allowing the government to control its behavior. And as we do that, we have a body like the Health and Safety Executive to look at the different risks that we might see and to determine how different levels of tolerability will allow policy to control that. And that control may be in terms of legal controls, it may be in terms of regulations, or it may just be guidance. And quite what you choose will depend on the risk and the severity of the impact that it causes. And so it's that significance of risk that we spend a lot of time looking at with HSE for different scenarios. The Thomas Ashton Institute is has a very wide remit across the university. It has people looking at the workplace health agenda. And so there we're considering all of the different threats that may come from agents or disease or exposure. There are issues across, obviously, the whole of the engineering domain, where we look at the strength and the defects in structures and the risk to people inside those structures if there are problems within them. Or it may be in the human factors side of the house, where one's looking at either the psychology and behavior and the acceptance of risk and stress by individuals, or indeed the ways one has of organizing those people and applying procedures and structures to allow them to withstand better the stresses and the pressures of their individual work. So it's that risk that lies at the heart of all of this. We need to understand its scale from a particular impact. We need to understand its level, whether the result, the impact of this is going to be catastrophic or non-catastrophic. We need to look at new risks as well as the ones that we understand. And obviously look at the exposures that one's had to those risks. At the end of all of this, we need to look at the availability or the necessity for some kind of standards, benchmarks, or even new regulations to try and minimize that risk going forward. So let me come back to the explosion that I talked about and look at it in a little more depth. On the 4th of August last year, there was a huge incident with actually a stored fertilizer, ammonium nitrate, that stored significant sections of the port. 5 years before that, in Tianjin, there was another of these incidents. 173 people died in that particular incident. And again, there was huge destruction that costs hundreds of millions of dollars to put back into place. And all of this comes from the properties of a material that go back to the time of Alfred Nobel, who first started marketing dynamite, that allowed a potentially hazardous substance put in the hands of people who didn't understand the details of its handling, and that gave rise to a very good engineering effect, but obviously catastrophic disasters when things went very wrong. And there haven't been one, but a whole series of these incidents, as we'll see in a moment, over the hundreds of years since Alfred Nobel patented dynamite. But for those of you who didn't see the explosion in Beirut, there was a quantity of ammonium nitrate that was stored there. And when it detonated, there were 210 deaths, 7,500 injuries, and $15 billion of property damage. I mean, the tragic thing about all of these things is not just the disaster itself, but the fact that in the long term, there were 300,000 people homeless there. And even a year later, that hasn't been mitigated entirely. And yet the problem is that no one knows the precise mechanism by which the accidental spark that lit the fire in the center of this went to a full detonation. And we need to understand how those processes happen if we're to put in place suitable mitigations to try and stop this. Talking about the history of these types of incidents, as I said, there have been several of these before. Over the years, there have been deaths at an almost constant rate. There are peaks in this. The First and the Second World War appear in there. But you'll see that there are thousands of deaths every year due to these incidents. And at present, there's no obvious physical mechanism that's been observed that can allow us to put mitigation in place to stop it getting to these disastrous points. So putting on the hat of one of my responsibilities that David kindly introduced you to at the beginning, I lead the university's activities at the Harwell National Labs. And so we're able, with the national facilities there, to get unique information about what happens inside a material non-invasively. You can see here an experiment done on an explosive where we had a simple column of the material. And on the left-hand side there, you can see that column with a yellow wire at one end of it, which we use to ignite the material. So that we're simply heating a wire at one end of this, and it propagates down that column as chemical reaction starts. We can observe the way the individual materials put together. And for those of you who've never seen these, what's possible these days, that's a three-dimensional X-ray constructed picture of all the grains of an explosive packed together on the right-hand side. Each one of them is given a false color, but all of that's created by an X-ray process without actually entering or looking at the materials themselves. And we can observe in real time the explosion happening. And you can see there, time running down the page, how the explosive starts to react from the left-hand side and transits to the right. The dots you can see in there, on the left-hand side, the black dots, on the right-hand side, the white dots, are little particles of tungsten added to the material so that we can see the material flowing after we've put in a particular hazard at one end of it. And you can see the way that progresses on the left-hand side very rapidly towards a full detonation at the end over a few milliseconds, thousandths of a second. On the right-hand side, however, and that's the inverse, by the way, so the white dots are what were the black dots on the right-hand side. On the right-hand side, you can see that there's a white plate in there, and that's the mitigation tool that we're using, which actually shuts down one of the transitions. It's a three-stage process, and by stopping us getting to the final stage, we don't reach the detonation that we did in the first case. Now, that is a process that hasn't been seen before, and so that gives us a physical mechanism by which we can start to put in place a mitigation to prevent a disaster such as this. But how we frame those risks and apply a result on a synchrotron to a disaster in a port depends on how we're able to handle all of the interactions that we're going to have with the various populations, industries, and of course, anybody else who might be interested in trying to use this research for other means. And we must decide who owns the risk, what is the risk to, and how are we going to handle it. And so I put up here some questions, the sort of questions that we consider throughout the Ashton Institute for all of the different scenarios that we look at. And something that was proposed by David Snowball, who's one of the people involved in helping us with the Institute, and a very senior former CEO of the Health and Safety Executive, into how we should consider these risks. And so we frame them according to who is going to be affected by them. We need to look at them from the side of what is the science and evidence base. And that's particularly where we as a university can really contribute here. We need to look at the scale at which we're looking at this. Is this a risk to individuals, or is it a collective vulnerability that this pressure is going to exploit? And how do we then assess these risks when we've found them? And we're all familiar in the sciences about how we might do that. Finally, if we're going to bring this towards some kind of a government agency, what guidance do duty holders need from government in order that those sorts of risks aren't going to end up in problems in the workplace? And then we've got to make the debate with population. How acceptable, what is the tolerance for these risks, and where and how much guidance and how much regulation will a population accept to mitigate them? And so all of these are questions that we need to consider, particularly at the moment, because of, obviously, the COVID-19 epidemic. We're at a particularly key stage, as we heard last night in the UK, because we're talking about now removing some of the controls that were being put on populations to mitigate risk. So we were talking about the same things in what I've done up to now, as the debate is continuing in the country at the moment. So far internationally, as of yesterday, there have been coming up to 4 million deaths. Many more cases than that, about 184 million cases of COVID-19 now recognized, and probably more than that haven't been. And it looks like a crisis that will be rattling around the world until we can find solutions and mitigations to allow acceptable risk amongst our populations. So we're now talking about the paradoxes within the individual risk questions that I was discussing. Obviously, governments consider the population risk. The threat is very similar in this particular case to everybody who is subject to seeing the virus in their vicinity. But the response of the systems is going to be very different according to the individuals. As many people have put it, we're all in the same storm, but we're in very different boats as individuals. And there are a whole load of questions with the pace at which the virus is mutating that we need to answer in order to be able to put in place policy to control this in the coming years. For instance, we don't know what critical mass of vaccine is actually required to infect an individual. We don't know the variability in an individual's response to a particular dose of vaccine. And if we could model that, we could produce individual solutions. On the other hand, we also don't know how we can answer these questions adequately to go forward. And so one of the things that UK has done is put in place a national program, and some of that I'll try and show you some results for at the moment to actually look at these details of transmission. So as far as UK is concerned, we've obviously had a number of deaths here. We are continuing a pace to try and look in detail at how things go. We've been lucky in this country because we have developed a vaccine. So we have put in one level of protection here, but we need to develop others because of the mutating rates and because the protection that we're putting in place does not protect the whole of the population that we're putting in place. And to do that, there is a typical method that is used in our business, and that's a hierarchy of controls. As far as COVID-19 is concerned, obviously we want to try with all of the risks to eliminate them. And the elimination part of the problem would be, simply at the moment, and I've got some examples on the right-hand side there of how it's been handled thus far. I'm really talking here about the previous year and how we put things into place and the measures at the moment. But to eliminate the risk, the simplest solution has been to stay away from it. On the other hand, less effective controls are ones that can be put in place of guidance or regulation. So another way of putting things forward is to try and substitute how you handle the risk so that you're not exposed to it. So remote working, for instance, distances yourself. Traveling alone rather than traveling in crowded buses or trains is another way of substituting your behavior to isolate yourself from the risk. We have engineering controls on the risk in terms of screens or barriers. We clean hands, we clean surfaces, and all of these are solutions to try and make us, again, distance from the risk that we put into place. Of course, there's guidance, and that may be down to telling us about the distancing we need to involve so that we are less likely to get the risk in our direction, or it may be, again, in terms of signage and cleaning regimes to, again, ensure that people are aware of the problems. And then finally, but the least efficient of these risks, there are face masks, gloves, etc., that one can take to go into an exposed environment. And these criteria from risk are ones that we really need to control. So as I say, the university has been involved in several programs looking at this. The national program run by the government chief scientist, has various strands. One of those, which is called Protect, comes through the Health and Safety Executive and looks at the transmission of COVID in the environment. The university has run several programs in that, and I'll try and give you an overview of the sort of results that are coming out. But these programs are not finished, and they're ongoing as we speak. And hopefully I can give you some ideas as well where the next forefronts of research lie. So as I say, we don't know what the critical mass of vaccine is that's required to infect an individual. That makes it very difficult for us to both put in place controls and to be able to track what we need to do in terms of new PPE, for instance. But we can use the University of Manchester's institutes and structures to allow us to look at those problems. One of the pieces of work that we're doing, which is known as the KUBS project, has looked into particular sectors. A sector will have particular pressures on it, particular controls that it has in place, and particularly exposures that one's going to get from the virus. And so we put in place a study to try and look at the transmission risks, to look both at the leadership and the practice that was put in place, all the way down to potential technologies that could be employed to allow workers to be shielded from those risks. And the results of those, these are preliminary, I've listed there. One of the things we see is that there is a very variable reaction across the population that we look to the particular threat that they perceive. There have been adaptations from working, and those have really been down to the social distancing measures, masks and cleaning that have been imposed by government. And yet, whilst they've had technology available to them in terms of remote monitoring, in terms of handheld devices, in terms of sensors on their bodies, there hasn't been an uptake of those technology solutions, partially because they're regarded as too expensive. Finally, there's been a reduction in compliance over time because people have become habituated to the crisis in which we sit. And unfortunately, that means that the effectiveness of controls is reducing, and there are impacts on the wider safety agenda as one puts resource into trying to fight this one. Of course, all of this has an effect, and when workers go home, there's a mental health impact, and certainly stress levels in society are a major problem and one that government's aware of. So it's not just the physical and mental effects that came out of our study as being critical, but they was driven by the financial effects of workers. For instance, at the lower ends of the industry, people were keeping the money that they got to take taxis, which would have isolated them from the virus, to try and mediate their own financial impact from the crisis, and then going on the bus and having all the risks that came with that afterwards in terms of transmission. So control has to be very finely tuned, and control has to be accepted and tolerated by the workforce. One of the things we were able to do was to look at the way that transmission occurred. And some of the, I don't know whether you're aware of some of the new modeling techniques, but particularly agent-based modeling shows the effectiveness here of something like the transmission rate monitored against distance between the various people. And so this has a simple model for the way people move around and a simple model for transmission. And using data like that has allowed us to start quantitatively to assess how simple measures like social distancing can affect transmission. But if you look at the top level of all of this, and we did look at the tier one rather than those on the workforce, at the work phase, if you like, a typical comment came out as COVID may have changed the world, but at the end of the day, the contract that I have to deliver hasn't. And that is, unfortunately, the realities of dealing with a crisis in the real world. So, as I said, there's also the possibility going forward of looking in detail at the transmission mechanism itself. We know that there are three possible ways of doing that, through touch onto surfaces, through the air, particularly in aerosols, and then close distance, person to person, where one's talking about droplet transmission. And that's a schematic of all of those mechanisms. And so another program now exists in the national labs where we are able to look particularly at the aerosol transmission. We're able to now label individual viral particles and track them all their way on their journey from the infected person out through the air in terms of droplets, or in an aerosol, that's smaller droplets that can travel without falling to the ground. And we can look at the effects that has on masks or direct ingestion into the person. And so that's happening at the national laboratories at the moment. We're looking here at the droplets themselves, able to trap an individual droplet and look at the viral load that there is within each of these tiny aerosol particles. And to give you an idea what that looks like, here's an example of an image that's taken of a series of droplets. I show one of those droplets, a typical droplet in yellow on the left-hand side there. And we're able to take gold nanoparticles. Each of these is about something like the 0.1% of the width of a human hair. So these are nanometers, which is small. We're able to tag an individual virus with those gold nanoparticles. And then we're able to use those markers and see where they get to within droplets. Not only that, we can look at what happens when they interact with masks or they fall onto surfaces and start to get absorbed into the body. And we can look at the whole of the transmission process from the moment someone sneezes all the way through to the moment the virus enters your body and starts to infect. And that should be a really exciting way of trying to see points where we can interrupt the pathway. But it's about where in that train can we put in barriers to mitigate. And in COVID, there are several of those mitigation barriers. One of them clearly is by using a vaccine. That gives you 90% protection. And obviously, it's one of the primary things that the world has used as a strategy to get this through. But there are other ways that we have of approaching this, and we're always going to need more methods. Some of that is going to be in terms of longer term use of PPE equipment, but hopefully in the longer term, we can increase better ventilation, we can produce better ways of trapping these viral particles when we start to understand more, as we did with the explosives, where we need to put in the mitigating barriers. And all of this comes down to the toleration of risk in the public. That risk literacy is going to be something that we really need to work on. And it's something that I think particularly Ashton has a role in acting as a way of forming the debate in the public. Because it's the public understanding of these risks that really determines the effectiveness of how they can be put into place. There are ethnic issues, we know. There is public acceptance issues. There are age issues. And further, there are geographical and economic issues which give rise to different uptake of COVID amongst the population. And obviously, we need to consider that the people have different risks just down to their different abilities or disabilities. And that means that we need to put in place mitigation for those going forward. So the complexity of a measure like removing masks is very large. Whilst it means that a large percentage of the population can feel that they can carry on life as normal, it increases the amount of infection out in the environment, and it puts the vulnerable classes in more risk. And that balance is one that we need to continue and keep very active, so that we can start mitigating this social contract between the government and the citizen. So it's that Hobbesian bargain that I referred to back at the beginning of this talk. So going forward, the Thomas Ashton has several goals going forward, and I'd like to see all of these in our future plans, particularly overlapping with obviously the other Manchester institutes, yours particularly. We will look at obviously the future hazards, to scan the horizon and see the hazards and assess their impacts on society. We need to look at new and innovative ideas to measure the impact of these hazards on society, on the workplace, or on the way that we construct our society. We need to identify emerging risks, and we need to start to put in place actions to mitigate them. We need to look at patterns of exposure and the vulnerabilities that come from that. And those patterns of exposure will depend on social aspects, but they'll also depend on things like technology, such as the internet and the acceptance of sensors and so forth. The most important function of the Institute and the university is to compile that underlying evidence that can then be used by government to underpin these new controls. And that's the primary bedrock on which Ashton was set up. And of course, because of the environment we're in, we can engage in the debate, and particularly around the tolerable levels of risk that I was discussing a little earlier. Finally, I think as a university, we have a duty to make ourselves as open as possible and a voice for risk communication and risk literacy. And I'd say that's the biggest challenge going forward. The world is now very aware of risk in a way that perhaps it wasn't before. And that's something that we should build on and continue the debate going forward to get that discussion going. Okay, so to try and summarize, a strong shock to a system takes a structure into a new state, and we've certainly seen that's how that's happened over the last year. When you apply such a large load onto a structure, it will take the quickest route to relieve the strain in there and try and reduce the stresses that it's seeing. However, if we get a shift in response, then we start to see new things coming out of this. And so some of the mitigating measures we put into place can be used to have an effect on the strength of the system we're producing. I hope I've shown, and I hope everybody's experience tells them that individual experience is very different to that of the population. So at all times, we need to consider whether we're at the micro scale or out at the population scale in what we do. And then obviously barriers and various mitigations can improve strength, can paper over various defects and differences in structures, and can prevent or mitigate failure. So thank you very much for that little brief talk. I hope that's given you some ideas of where we feel that we might work together going forward, and several of the areas that perhaps as a university we can engage publicly to try and look at some of these problems around risk and the regulations that ensue going forward. So it's been great talking to you. Just as a final little word on where we might go in the future, I came across this diagram many years ago that talked about the frequency events against the size of the disasters that might result. And obviously in a crisis management and mitigation center, you're worried about these as we are. Obviously, the worst case of those would be a mass extinction event. We've seen a biological disaster over the last year, but that's only caused 0.1% of the world population to result from that. There have been extinctions in the past that were rather more serious. One of those happened at the end of the Cretaceous period, 65 million years ago, when an asteroid hit the Earth. It caused an impact on the surface, and that impact on the surface was such that the pressures had taken the rock underneath into a liquid state. And you can see that there's a little blip in the center of this where a pillar of fluid rock came out of the Earth. That was responsible at that time for the death of the dinosaurs. And I'd just like to note in my closing remarks that in 2028, there is another asteroid that is not known to be on collision course, but is within, I think, 2 Earth diameters of us that will pass us by. That we are in a position where these global disasters, cataclysms happen. They happen on a period of around 100 million years. And just to say, the orbit of the solar system through the central galactic plane takes us about 200 million years. And so we're just about to go back into that galactic plane. And that will mean that we're about due for another of these cataclysmic events. So with that, thanks for your attention. And I'd be very happy to take any questions that any of you may have.
Thank you for that, Professor Bourne. Nice way to end it. So if anyone has any questions, feel free to put them in the chat box or let me know, and we can I can call on you to unmute your mic. In the meantime, I'll kick it off. I take your last point about the mission of the Institute. You know, one of them is to convey risk and uncertainty, and you know, to get the public on board. And how do we, and perhaps this relates to your link with you know, the HSC as well. Given the fact that the government seems committed to opening up very quickly as cases are rising, there seems to be some kind of imbalance between what you know, they say they're doing. You know, we're following the science versus you know, we need to open up and turn off otherwise, you know, sensible things like continuing to wear masks and so forth until these things are under control. What do you think the role of our kind of centers are in influencing this kind of public policy decision?
Yeah, I think that's a really, really good point. And obviously it's a very interesting question that people have got individual answers for. It's certainly true that we're heading to the point, and I think the predictions will say we're going to be moving to 60,000 cases because of this decision to remove the masks. We're on that flight anyway, and we have a virus which is probably twice the effect of the original one that hit us from Wuhan 18 months ago. So the question lies with the risk, and you know, the risk, as I talked about earlier, was composed of lots of different components. As far as a national level is concerned, It's composed obviously of the impact that the virus makes itself in terms of the number of deaths, and the number of deaths then affects hospital capacity. But there's also a proportion in there which looks at economic impact and so forth. And so there is justification that they will put to their individual viewpoint on all of this. As far as we in the university are concerned, we can help that debate by putting forward the evidence that we have around this. Some of that may be around the transmission, some of it may be around the experiences, such as what I was talking about from the construction sector that we've been looking at. Some of it may come from the physical mitigations that we can put into place, such as we're able to do at the national labs. But I think the university's role is to make these issues as easily accessed as possible by the public, and reduced to the simplified forms where we can look at these major risks most effectively to make and help decisions to get better.
Great.
But it's horribly complicated.
No doubt. One other question from me. Thinking about where your institute is now, where you want to go, you know, and already the you know, the short time you've been around, the impressive number of you know, connections and collaborations that you've built. Are there any topics, disciplines that you wish that Manchester had expertise in, or that maybe you're looking for that expertise within the university and you haven't found it? You know, so you can kind of put out, you know, a classified ad here with your answer, you know, that if anyone knows any connections, you know, to get in touch with you. What do you see as you know, your needs and you know, what we can do now to help you advertise, you know, for those collaborations now or in the future, what you foresee?
Right. That's really useful for us. So the institute, as you say, is quite young. It's a few years old. We're probably into our third year since launch now. It was obviously launched around particular questions that were prominent then. And because it is a partnership with the Health and Safety Executive, they have an equal say in the sort of areas where we started that search. But things have changed so rapidly in the last year that we know that there are a whole new set of areas opening up, some of which, as you say, the university or indeed any organization can never have all the available expertise to look at the complex world of risks that we're addressing here. And so one in particular that I would mention, you'll all be aware of the Grenfell fire disaster that's in the news at the moment. So 2 years ago, that caused obviously a horrible loss of life. And in the subsequent inquiry, Dame Judith Hackett has found both particular engineering issues, problems with cladding, for instance, but also particular organizational and legal issues. And those have come to a head with a bill in government and the proposal that the Health and Safety Executive, our partner, will actually be the regulator for all high-risk buildings. One of the areas the university is strong in is fire engineering, but looking in areas around the legal side of this, around the social impact on residents, the university doesn't really have that sort of expertise. However, it does have obviously other interest groups within it, being such a large and broad university. So particularly the Manchester Urban Institute are very well aligned in this space. And what I've been looking to do, and one that's certainly going to be supported by government in its various forms, is to try and set up a network across all universities within the UK in order that we can have that debate and in order to get that evidence base. And it's this word evidence base that is the clear output of what we can bring to the regulatory environment. But if anybody would like to join us, risk is a very broad concept, and across every field there's some risk or another. In many ways, I keep saying to the university, Ashton is more of a platform than it is an institute, because it doesn't have a single focus, yet it does consider risk. And as I say, risk enters all our individual working areas, doesn't it?
No, that's a great point. And again, one of the things that's really important to me is this communication of uncertainty and decisions, in looking at the future and so forth. So fully agree with your statement. Just a
The
couple more
final thing
minutes.
I would say,
Go
one
ahead.
interesting overlap that we might have is, what is the acceptance and the kind of trade-off that one makes for provision against low frequency events. So if you're dealing with tropical cyclones, for instance, and they only occur every few hundred years, or you're dealing with these pandemics, and again, they're on a relatively long time scale. How do we engage that debate about the trade-off between risk and resource that government has to provide to allow us to prepare for these things? And I think that COVID perhaps does open an opportunity for us to start looking at other kind of low frequency, high consequence events and start that debate again.
Great, thank you. And I see we're at the top of the hour. So as I mentioned, this is the last seminar for the summer. We'll take a break in August and hope to restart in September. So if you're not on the mailing list or following us on Twitter, please do so. You can sign up for our mailing list on our website at the university website. Great. So again, thank you, Professor Bourne, and hope to see you when we restart in the autumn. Thanks again. Bye.
Thank you so much.
Thank you.